Hi, I'm Cynthia. I'm going to be your student nurse today. We're going to be doing a physical exam, head to toe, if that's okay.
Yes, absolutely.
All right. I've already washed my hands outside the room. And if you'll state your name and your birthday, please.
Melissa France, July 15th, 1969.
Okay. And have you had any difficulties bathing, dressing, or walking?
No.
Needing any assistive devices?
No, not at all.
Okay, very good. She's well groomed. Her speech is nice and clear, and her hearing is appropriate, along with her affect to the conversation. And her hygiene appears nice and clean. So we're going to start off with evaluating and inspecting your skin. And her skin is nice and clear, no rashes or inflammation is noted. It's nice and warm all the way down to the hands and moist. Her skin turgor is brisk, and her other arm, skin turgor, is also brisk. On her hands, her nail beds are round and smooth on each hand, and the cap refill is less than 3 on that hand and less than 3 on that hand. No clubbing is noted or hypoxia is noted. Looking at her head, she is normal cephalic on the structure of her head. Her hair is well distributed. The hair itself is nice and shiny texture. No patches are noted. And I'm going to palpate to make sure and let me know if there's any tenderness all the way down. I'm looking for lesions or bumps or depressions down to the occiput. No tenderness?
No.
Okay. Then I'm going to feel the temporal pulses. That one on the right is palpable, left is palpable. And looking at the eyebrows, they're both symmetrical, and her eyes are symmetrical. The hair is distributed evenly on the eyebrows, and the eyelashes are curved outward. Can you please smile for me and frown? And there's no facial droop noted. Then we are going to check the sinuses, the frontal sinuses. If there's tenderness, let me know.
No.
And the maxillary sinuses, let me know.
No.
Okay. Then I'm going to check the mandibular joint and open and close. Any pain?
No.
Okay, no clicking was noted as well. Then I'm going to move on to the lymph nodes, and we're going to start with the preauricular lymph nodes. If there's any tenderness, let me know at any point.
Okay.
Those are soft. Posterior auricular, soft. And then we have the posterior cervical, then the occipital, and then we have the superficial cervical, the submandibular, the submental, and if you shrug forward, the supraclavicular lymph nodes. Any tenderness in any of those?
No.
Okay, now we're looking at the ears. We're checking for symmetry. They are symmetrical, lined up with the eye line, and I'm just going to tug on each one just to see if there's tenderness.
No.
Checking for any external canal infection.
No.
Then I'm going to palpate the structure starting at the pinna and moving my way down to check if there's any tenderness or nodules.
No tenderness. Mm-mm.
Very good.
Nope.
All right. And then I'm going to do the whisper test, and I'm going to cover one of the ears and whisper and just repeat to me.
Okay. Apple.
Sorry.
Apple. Airplane.
Okay, hearing is intact. And now I'm going to use the otoscope. And we're going to take a look at the tympanic membrane. I'm going to pull up and back on the pinna, carefully stabilizing the otoscope. Taking a look at the tympanic membrane, I see the cone of the light, the handle of the malleus, the bony prominence, and the umbo. And we're going to check on the other side. Pulling up and back on the pinna. I see the cone of the light, the bony prominence, the handle of the malleus, and the umbo as well. And that concludes the ear section.